San Juan Regional Medical Center has done a really fantastic job in responding to the COVID pandemic. We started meeting, discussing the coronavirus outbreak out of Wuhan, China, in late January and early February, eventually coalescing into a formal incident command response.
I think our emergency preparedness program is actually one of the best around, and I say that because we recognize that we are not alone. One, we're a community hospital, and I think the county recognizes that. So we've got a good group of city and county leaders that recognize that this is a community response.
Because of our years of preparedness work, we were able to utilize that background and that framework and structure to assist us in creating a methodical approach to dealing with COVID.
The emergency preparedness program here, I feel, is very, very strong. And that's not just organizational wide with the hospital, but the community and Mike Mestis and the emergency management team there and first responders and all of that. Everybody shared the exact same interest at the exact same time and got together in the community very, very early on.
Our organization has been able to accomplish a lot during the pandemic because, one, we've had a pretty robust leadership and incident command team that identified that there was a public health crisis.
I'm really proud of the team. I'm proud of the group of folks that I've been fortunate to work with. When asked to do unprecedented or what would be seemingly impossible things, they've risen to the occasion to build, develop, and restructure things in a manner to meet a dynamic and changing need. Really, just such an amazing, amazing job.
I have to say how proud I am of the organization in terms of its teamwork. We have had to bring people together that don't normally work together and do tasks that they don't normally do. And the open-mindedness and the cooperation of our team has really been amazing. And then on top of that, to work through really hard times. This has been stressful. It's been stressful for our medical staff, for all caregivers at the organization. It's been humbling for me to be a part of that. It really has been amazing. And I have to say, more than once, it's brought tears to my eyes to talk about this team and how they've worked together.
When I think about what's made me most proud to work with everyone that we've worked with throughout this public health emergency, there's so much to be proud about. When you look at what the community has done to back us through financial support, direct financial contributions to support our need to acquire PPE, a very substantial donation by a single physician who wanted to make sure patients who we were monitoring at home had access to a pulse oximeter. The homemade mask that you see so many of us wearing, made from countless or by countless people throughout the community. The various PPE made by the college and PESCO and others through their 3D printers, just to name a few. It's been remarkable.
You know, everyone is stepping up. Everyone is going above and beyond what their job description is. Everyone in the organization is seeing the effects of COVID-19, and that makes me very proud.
One of the things that has really made me the most proud of the critical care team and our whole group at San Juan Regional as we've faced the COVID pandemic is just the support that we've been able to give to each other, the encouragement. There's a lot of, we faced a lot of things that are discouraging, things that are challenging, things that are exhausting physically and mentally and emotionally, and just being there for each other, communicating in very supportive ways and letting each other know that every every discipline, whether it's a physician or a nurse or a radiology technician, that we're all working together to make things run smoothly and go well for the patients.
I have seen the ultimate sacrifice of some healthcare professional give their ultimate sacrifice of losing their life because they were running towards those patients who needed to get help and needed to, they sacrificed their own life.
I'm very proud to work at San Juan Regional Medical Center.
So I really feel that the key to our successful response has been our ability to work together as an organization, as a team, and as a family.
We've held each other up, but we've held each other up to really high standards. And I think the ethics and the dedication has been just astounding among all of my colleagues. It's not just an individual that has responded so well to this. This is us as a collective.
So many things that contribute to the success of the way we've been able to manage this situation currently. Every person that works here contributed significantly and still does and still will. The way the people come together to do different things, do roles they've never had to do in their lives before, learn fast, be resilient, and accountable. And it's amazing to me how many experts we have in this community in so many arenas. If you just go back and mention some of the things that this community was able to do, from making gowns out of Home Depot Tyvek to volunteers sewing them as fast as they can, building homemade respirators and ventilators in-house, all the help from the community oil field and Pesco companies and the makers labs, and everybody in the region pulled together to make things we did not have that we needed.
The emphasis we've placed on communication, as communication has become more difficult during the COVID pandemic, whether that's with patients' family members, with patients, we have just looked for new ways to be able to make those interactions meaningful. And that's something that I think has just made the work atmosphere feel like we're working as a team, and that's something I hope that continues.
I feel that the key, honestly, is it has been our staff. It has been the help that we've been receiving from the incident command. Our staff is the backbone to the program. They have been very involved. It has been very challenging at times, very emotionally draining at times, just because of the intensity of it. But everyone has been very, involved in it.
If I were to have to put my finger on one single key that's been the foundation of our success so far, I can sum it up in a very few words. It's the people. It's the people that have been involved in the Incident Command Center. It's the countless people that have been involved on the front line response to direct patient care, whether through our external assessment area, in the emergency department, in the inpatient units, whether at our clinics, urgent care, etc. It's the people that have been the key to our success, plain and simple.
The San Juan Regional Medical Center has a fantastic set of core values that help guide us, and I think that there are a few that definitely come to mind. Thoughtful anticipation, I think, is one that we really took to heart and tried to make sure that we were anticipating the challenge to come and to try to build a robust response and a framework that was able to be adaptable to meet the needs of all of our patients and healthcare workers.
I think team accountability is something that is very clearly valued within our organization and is demonstrated really on a daily basis and has been truly magnified by COVID and our COVID response.
When I think about our response to COVID-19 and what has allowed our organization to be so successful and accomplish so much in such a short period of time, my thoughts first go to our core value of sacred trust, which is to do the right thing for the patient no matter what. That thought has permeated our response organization-wide.
Everyone takes to heart who's been involved in this response is the idea of team accountability, that we're all in this together, and we are all, it's really important for each of us to fully grasp the nature of our own individual responsibility and how we need to hold ourselves accountable to do the best job that we can for each other, as well as all the different patients and families that we serve in our region.
One of the biggest values, I think, in critical care as we've faced the COVID pandemic is the team accountability, just relying on each other to be able to help each other with the challenges that we faced and some of the barriers that we've come across in learning to care for patients with all of the PPE and the different requirements that taking care of COVID patients requires of us. But I think also creative vitality has been something that has impressed me the most, because as we've hit these challenges and barriers, everyone from nurses to physicians to support staff has had to come up with a lot of ideas of how we're going to meet those challenges, how we're going to continue to care for patients.
The value of sacred trust really helps reflect how we've had such a strong focus on healthcare worker safety. It's been very, very important to us to make sure that we maintain adequate supplies of personal protective equipment and build training programs around that.
I think really all of our values have helped to guide our action. But in my own area, both creative vitality and team accountability have been represented loud and clear. The teamwork has been astronomical.
We were successful because of our values.
So I want you to know how much each and every one of you are appreciated. As challenging as these times are, as difficult as the decisions are that we've had to make, as challenging as the patient care has been for those of you on the front line, as hard as the work has been for those of you who are supporting our frontline caregivers, every single bit of it is acknowledged and recognized, and for that I'm very thankful and deeply appreciative of each and every one of you. So thank you, God bless, and let's keep moving forward together.